Japaigo's Donna Miranda meets women where they are, often in the cramped, crowded slums of Manila and other parts of the Philippines. The petite Miranda, unmistakable with a sleeve of tattoos encircling her right arm, walks confidently through the warren of alleyways, stopping at corrugated tin homes and stepping through doorways to talk with women about cervical cancer screening. Today, she is at a recreation center in the middle of a bustling neighborhood of Quezon City. Within a few minutes, she and her team of health workers and volunteers transform this center into a cervical cancer screening site. Soon, women from the neighborhood begin to arrive. Cervical cancer is the second most prevalent form of cancer among women in the Philippines. This, despite it being one of the most preventable and treatable forms of cancer. Many of these women visiting the makeshift screening center have never had a reproductive healthcare checkup before. Donna, Japaigo's awareness and demand generation officer, knows what holds them back.
Health behavior is very complex. It's determined by a number of factors. Even if you convince them that a service is free, they will not necessarily take it because they know the service is free, but the loss of opportunity while being sick actually is heavy, economically heavy. The second thing the questions that we encounter is that I don't want to know if I have cervical cancer because it's bad enough that these people cannot access healthcare. But if they get a grave illness, then it brings anxiety to them that they'd rather not know. In Filipino culture, we call it the bahala na mindset. It's like, I leave it up, never mind, just leave it up to whomever, to God or something.
Donna explains to these women and their families how a timely detection and treatment can prevent an infection from developing into cancer and informs them about the free services they can avail in case of being found with cancerous lesions. Donna and her team are at the front lines of a multi-country, UNITAID-funded and Expertise France-led project called Scale Up Cervical Cancer Elimination with Secondary Prevention Strategy, Success, in short. Along with strengthening the system's capacity to detect and treat lesions in time, Japaigo is building awareness, generating demand, and bringing cervical cancer screening services into the communities. The key to the success of this project, believes Donna, is not just to create awareness, but to get women to actually walk into these testing sites. She uses the power of communities to make this happen, recruiting volunteers from community organizations, women and mothers associations, workers groups, and even farmers and fisherfolk organizations to enroll women within their communities to get screened.
Apart from doing health education and building awareness, it appeared that for individuals and for women to make informed choices about their health, they should feel empowered. And so it was kind of a logical step to work with people's organizations, organized groups of marginal sectors, because they have that with them. They have an understanding of we will make our lives better by organizing ourselves, mobilizing ourselves, lobbying for ourselves. So they were able to recruit their neighbors, their friends, their families to sign up for cervical cancer screening.
The use of volunteers and citizens groups has helped Japaigo successfully screen more than 11,000 women in the Philippines. In 3 years, the program wants to reach more than 15 times as many across its geographies, screening 175,000 women to scale up cervical cancer elimination and contribute to the global 90-70-90 targets set by the World Health Organization. Japaigo's leaders like Donna are working tirelessly on the ground to help achieve this worthy target.
I find it rewarding. If I wake up every day and if I can choose what to do, I'd choose to do this every day. I mean, I'd choose to be here working with people, helping them figure out solutions, bringing health services to the people. I've always thought of health and the status of a country's health as an indicator of a human condition. And if you want to make a difference in history or human condition, then health is really that place to do that.